Okay, I believe we are live. So, welcome everybody to our talk story, Choosing Your Birth Journey, with Emi from Journey Midwives, and she brought her client with her. Yay! I'm so glad we could do this with you, Emi. Thank you for joining us. So, what I'll do is I'll just let everybody go around and do a quick introduction. For those of you on Facebook who don't already know me, I'm Mia McFarland with the Pacific Islander Health Board doing outreach coordinating. And then I'll pass it to Mary.
Hi, everyone. I'm Mary Conception. I am a lactation support peer counselor at Open Arms.
Awesome. And then Emi.
Yeah, I'm Emi Yamasaki McLaughlin. I'm a licensed midwife here in Seattle, and my practice is called Journey Midwife Services.
Awesome. Thank you. And then Mira, if you would like to introduce yourself and baby.
I'm Myra. This is Rustin, and we are the family helping out today, talking about our birthing experience.
Oh, so cute. Thank you. All right. Mary.
Well, I guess we'll start with a question for you, Emi. What services does Journey Midwives provide?
Yeah, so we're a licensed midwifery practice. That means that we do home and birth center birth for folks who are low risk in health. So that basically means, folks who aren't, don't already have like pre-existing diabetes or pre-existing like hypertension. For those kinds of folks, we also offer supportive pregnancy care. It's a model of group prenatal care. And so folks can get the experience of midwifery care, but if they need to see an OB, who can manage medications and things like that, then they can kind of get the experience of both.
Oh, that's dope. Okay.
Yeah.
I love that. So I've kind of heard maybe you could talk a little bit more about this, but is there a supportive pregnancy program that you provide?
Yeah. So that's our model of group prenatal care. It's called supportive pregnancy care. It's a model developed by the March of Dimes. And what we do, it's funny because we actually started this right at the beginning of COVID, or like right before it started, a couple weeks in like early February of last year. And so the idea is that we get, all these pregnant folks together and we talk about specific topics, each week. I work with 2 health educators, one from the Black and African diaspora and the other from the Indigenous and Latinx diaspora. So we get folks together and talk about like specific topics, and it was really sweet the first couple times we met, and then suddenly COVID happened, and so we had to switch to doing it virtually. Which sounds, doing Zooms is not my favorite now, but actually for the pregnant folks, it's been really awesome because, no one can leave their house and folks are really isolated. So being able to get together, even on Zoom, just a lot of folks have really enjoyed the experience, and I'm sure Myra can talk a little bit more to that.
So does the supportive pregnancy, is it year long? Can anyone just, how does one enroll in it?
Yeah, it's a 10-week series. And so we end up having about 4 or 5 cohorts a year. If anyone wants to join, they can just reach out to either Journey Midwives at gmail.com. Our website is journeymidwife.com. Or you can find us on Facebook and message us that way. And then we, get you enrolled, ask you some questions, send you the Zoom link. We are grant funded, so we do have to, ask folks about their demographics if they're willing to share that information. But it's pretty cool.
It's awesome. I love it. So you were talking a little bit about having a staff members from the Africa diaspora and the Native American Latin diaspora. So I'm curious how culturally informed the work that Journey Midwives does, and like, how does culture impact the kind of work that you've been doing?
Yeah, absolutely. It's interesting because I am Japanese American and white, and I do work a lot with folks from, many ethnic communities here in Seattle. And it's pretty important to what we do. You know, I'm not Black and I'm not Filipina. You know, so I do, you know, I invite my clients to bring their traditions into, you know, their birthing space and into their care with us. So sometimes that looks like folks talking about herbs that they use at home and they want to know if it's safe for pregnancy, or it's talking about that their, that their, parents had that they want to, share with their, new baby and their new family. So we just really encourage a space for that. And then my health educators, who represent, these Indigenous and Latinx and African communities, they bring in their cultural traditions. And again, we just try to really create a space where, if you have a cultural tradition that you're trying to bring back, that's what we're seeing a lot is a lot of folks, know about some of their cultural traditions, but maybe it hasn't been practiced in a generation or two. And so we can support that. We can encourage them to do that exploration. And if, they are Black or Indigenous or Latinx, we can share that knowledge that we do have.
Yeah.
That's really beautiful. So I have a question for Myra. What was your personal experience with a midwife? And Emi is your midwife, right?
Yes, Emi was my midwife. And my personal experience was phenomenal, especially considering, you have to chime in. Considering the pandemic, I didn't have any family here to help me, so I was pretty isolated. And I did have a few friends, but again, we weren't sharing bubbles. So having the support of Emi was critical when I had questions, knowing not just anyone could come over and that I couldn't at that time just go anywhere to get help. So for me, being able to talk to Emi, whether it was via phone, through a video chat, or at appointments, was really helpful. And just the personalization, like Emi had talked about, bringing in what honors you and honors your birthing experience was really important for me. I decided not to do a hospital because I wanted someone who was going to really look at me and understand and hear me, especially knowing that COVID was still so new and we didn't know what the effects were for pregnant women and those birthing. So that ear and awareness really made it that much more comfortable and in honoring the whole process for me.
I love that. And especially thinking about like how things were during COVID and like the amount of restrictions people had, and like my brother's wife went into labor during COVID and they weren't even sure if my brother was going to be in the delivery room with her. And so I think, that's amazing that you had that one-on-one experience with Emi at your side. And
and I knew who I was getting versus if you go to a hospital, you may or may not get your OB. And with COVID already feeling daunting, just knowing who was going to be helping you and catching this beautiful life, it was that much more comforting that you weren't worrying about big staffing changes and, lots of sounds and lights and things that are so new to a baby and overstimulating. So for me, it was really nice to have that continuous care with the same person, and then after too, with the follow-up care, that the same person saw me through the most critical points in the pregnancy and delivery, and then the aftercare when it's, the most dangerous.
right, that's true. And I feel like that a lot of parents kind of feel like they're left just to figure out what happens after baby is born. But I'm glad to hear you did not have that experience.
No, Emi definitely followed up within the first 24 hours. And then, the next 48 hours after that, and then our follow-up wellness appointments. So we definitely had plenty of care, and Emi being a lactation specialist on top of it really helped me figure out stuff, because when I was nursing, it hurt, and I didn't know about lip ties or tongue ties. And Emmy had that knowledge in her back pocket to be able to guide me through that, because again, you're in a pandemic, you can't just go anywhere asking people for help. So you had to really have that specialized knowledge to be able to reach out to the resource, because not everybody just lets you walk into the doctor's office now.
Right. That's fair. Aw. And I can see that you both did a really great job, because baby's super healthy and so cute. Oh my God. I come borrow him for a while. Free baby.
Sure,
After-
you can.
That's awesome. All right. So I do have a question for Emi, and I think we've touched a little bit on it, but maybe if you could just talk more about like what a midwife is. And people have asked, like, are midwives doctors? So if you could just talk about that a little bit.
Absolutely, yeah. So there are different kinds of midwives. I'm a licensed midwife. There are also nurse midwives. A nurse midwife is more likely to do deliveries in the hospital. And so nurse midwives, they can do like well woman care. They can prescribe antibiotics and contraceptives and stuff like that. Unfortunately, I can't do a lot, those things specifically. So I care for folks during the childbearing year. So when they're trying to get pregnant, once they get pregnant, and then for the first 6 weeks afterwards. And like Myra was saying, we do your normal newborn care. So for the first couple of weeks, you actually don't have to go see anyone else. We take care of your baby. If it looks like my friend Makita is watching. Hi, Makita. If a baby has to go see the pediatrician, then we'll definitely tell you if we want you to take your baby to the pediatrician. But that's kind of nice for folks that they don't have to go. They don't have to go anywhere new. When you have this brand new little fresh tiny person, that it can even be scary to put them in a car seat. New parents get a little worried about that. The other thing, that I feel like is really special about what we do is because we're not doing this in a hospital, we're doing it at the birth center. It's a little more personalized. I get to know my clients better, and I also get to know their support people better. So, because we're going to be together during, an intimate time when someone's giving birth, and these parents are essentially being born, as well as this new little baby. So, just being in a more home-like setting. So Myra gave birth at the birth center, which is in Madison Valley. So we're really close. If we had to go to the hospital, we would go to Swedish First Hill usually. Usually when we go to the hospital, it's not an emergency, actually. It's like someone has a really long labor and actually wants an epidural or something like that. So in that case, we can go to the hospital. So we don't do epidurals at the birth center. We don't do epidurals at home. So some of our folks, if they, know that they want to work with a midwife and get to know us, but also know that they definitely want a hospital birth because, or maybe they need that because they have a more complicated pregnancy. That's where we can do some of that co-care with the group prenatal care. So folks can, still see us, so we can still talk to them and give them the education. But their OB or their nurse midwife in the hospital is responsible for their medical care for prescribing their medications and monitoring their blood pressure and things like that. So that's the thing that I find that clients like about midwifery care and about the group prenatal care model is they just want to talk about what's going on with them. They want to talk about the changes in their body. When they have this new little person on the outside, they want to talk about my baby poops every 5 minutes. Is that normal? And we're just here to say, yeah, it is. And, just over and over again, we're just here to support folks and answer just questions that you might not pick up the phone, call the doctor for, but since we're seeing you so frequently after the birth, we can just get them off your mind so you don't have to worry about it. You asked what other services we offer, and so I want to talk a little bit about our lactation services as well, if that's okay.
Yeah.
So we also have Lactation Lounge. We do it on
Tuesdays.
Afternoon. And that's what keep folks surprised at that. But in the Lactation Lounge. It's free. It's a drop-in, and anyone can come on Tuesdays. And then, like I said, on the Saturdays, actually, anyone can come to that one too. That one's open. They are from the Tuesday one is taught from like the perspective of the Indigenous health, the Indigenous lactation specialist, who's Elizabeth, actually. Myra's been to that one. I also am there, and I'm working on some lactation certifications. But I kind of leave it up to Elizabeth. She kind of leads it, and then Nikita is the health educator for the Saturday one. And so she kind of leads that one with the support of Binta Myang, who's my midwife partner, who's also watching on Facebook, I saw. So, yeah, so those are free drop-ins that folks can come to. They can ask questions, and also, honestly, during COVID, folks just hang out and just like breastfeed their babies, just like you would. So the Lactation Lounge was put on by Campy Gold. She like designed it. She's a local lactation consultant, and she's like one of 2 native lactation consultants in North America. Yeah, so we're in partnership with her. But folks just come and they'll just nurse their babies, in the Zoom, and just hang out and ask some of those just like troubleshooting questions. But again, not things you would necessarily like go to the doctor for.
Right.
Yeah.
That's awesome.
Can I chime in about that too?
Absolutely.
For me, Lactation Lounge has been vital, especially when I was running into issues, and you can't just go and ask your friends or anything like, hey, did you experience this, because you're in COVID, and trying to get into the doctors is really hard right now sometimes because they're limiting appointments. And so being able to just show up at Lactation Lounge and drop in as needed has been critical with questions, and also getting the support, because you can do a PEPS group online, and there are other groups you can do online too that help. But, breastfeeding is really hard. People don't tell you that. And Lactation Lounge really was a gift that kept on giving and still keeps on giving. So I highly encourage people to find something, if not Lactation Lounge, similar, because right now it really, as a mom, it's a support that you don't even know you need until you're sitting there and you are like, wow, you too, not just me.
Yeah.
Yeah.
Oh, Mary, were you going to say something?
I think I'm having trouble with my audio. Okay.
Oh, there you go.
Yeah, there we go. Yeah, the lactation is facilitated by some great. Elizabeth is awesome, and it's so nice to have a community there, like you were saying, Myra. And there's a question from the from the health board. It's is it virtual? And yeah, for right now, the lactation lounges are virtual. And then once we can all come back into the world and be around each other, it will be in person. But there are plans on keeping some elements of it virtual, I think, is the talk. So. Let's see. Our other question is, and I think, Emi, you might have touched on that, but so midwifery care, what does that look like from start to finish? Like, how early do you typically see one of your patients, and what's the process like?
Yeah. Folks can start their care with us as early as they want to. Some folks, they pee on a stick and they call us the next day. That's just don't find out that they're like partway through their pregnancy. So even if someone is like 30 weeks or 32 weeks, they could still give us a call, and we can, we do a free consultation visit. So we're doing that virtually. Pandemic. But we schedule it for 45 minutes to an hour. So like I said, we do a lot of talking, just kind of educating folks about what their options are, what we offer. In that visit, we would
Uh-oh. I mean, I think you're breaking up a little bit.
Can I jump in and talk about my experience with Emi when I first talked to her while she gets herself situated with the internet?
Yeah, I would love that.
Cool. So I actually shopped a few midwives. I was seeing an OB at UW, and it was fine and all. And the reason why I stuck with him as long as I did was because he was also my cancer doctor. And so I was fortunate that he was also my OB through my pregnancy. But I was coming up on, I believe it was June or July. And I was like, I don't feel good about going to a hospital right now. And he started pushing me into needing to schedule a C-section. I was like, but I'm healthy and all that. Anyways, so I shopped a few midwives, and there are quite a bit of organizations around, and I'd spoken to people that weren't of the Pacific Islander Asian descent, and I was like, no, you're not hearing me, or I'm not comfortable. And I found Emi, and Emi really took the time to listen and connect with me and understand what I was bringing to the table, what my story was, and how I wanted my story to go with my actual birth. She not only listened to the background and what I'd gone through, but she let me determine what my story was going to be and how she could add value to that story as a midwife.
Wow. Yeah, that's amazing, because I think it's a special time in your life. And so for someone to sit there and actually listen to how you want it to go versus telling you how it's going to go, that's amazing.
Right. Especially when you're like, wait, no, why do I need a C-section? And they couldn't give me a reason. So when I told Emi how I felt about that, she really understood. And then when I actually was delivering, and there were some skeptical moments where we're like, we might have to go to the hospital, Emi understood to the point where I could just look at Emi and nod my head gently, and she knew I was ready to push.
I think
is Emi back?
I think so.
Yeah.
Cool.
You cry, Myra.
Aw.
Yeah. It's oh, I think I'm muted.
Oh, we can hear you.
Oh, great. Yeah, I just Myra's she's really sweet, and we had a really sweet connection. Yeah. And we had a good birth together.
Yeah. Oh my gosh. I just love that, like, over that span of like Myra's pregnancy, you were able to get so close and understand exactly what she needed. Like, I think that's something that when I hear about other people's birth stories, they can't really tell me about traditional, like, in hospital care.
Yeah, it's it's special work that we do. I don't, in the hospital, they care for hundreds of people, and they do, such a good job, really managing really high risk pregnancies and things like that. But, for someone who more needs that connection, and that's like the primary thing that they need, it works out pretty well when we get to be together, during labor and birth. And it's also why I'm glad that, midwifery is really accepted here in Seattle, that my clients, or that all pregnant folks have options about who they can go see as a midwife. That we have a lot of midwives here in Seattle, and we're having more and more, particularly BIPOC midwives, all the time, that we can have that cultural congruency that can really make a difference.
Yeah, that's true. Because it does make a difference when you see someone who looks like you providing for you. That's true.
Yeah, and understands your culture, and you don't have to necessarily explain why you want to do certain things. It's just understood. Yeah, and what a beautiful story about you co-create your own birth story instead of being told, like, this is what you're going to do. That's so special. That's so beautiful.
Mm-hmm. Yeah.
Is that connection something clients receive from midwives?
I would say, yeah, it's part of the relationship that we build over the course of the pregnancy.
Mm-hmm.
That we're trying to build that connection. And if you don't feel that connection with your midwife, with your care provider, you could interview other folks, you know, or have other people involved in your care, like a doula, or a lactation counselor, you know, to get that connection. Because I definitely think it can make a difference. It's not always the most important thing, but definitely when we're planning an out of hospital birth, that's why we do spend so much time with our clients, is because it does make a difference that they get to know us, we get to know them, but they get to know us, so that they can feel safe when we're in their birth room, you know, and their baby. It's kind of a big deal. If the person in front of you is someone that you don't like or annoys you, that's not going to work out too well for the person having a baby.
Great and fair point. So I have a question that can apply to both of you. I think it's a really good one. So how did you learn about midwives? And then maybe we can start with Emi. I'm very curious how you got into this work.
Oh, yeah, thanks. My mom had midwives. My mom had midwives with all three of us, and so my mom was like a big hippie, and she had her babies, all three of her babies, at home. My sister and I were born at home in California. The story of my birth is that I was the second one, and right at the end, I came so quickly that the midwife didn't have her gloves on. Also, that she had an OB backup who was, because this was the very early 80s, the OB backup, his job was just to sit in the corner, you know, and he would be there in case there was an emergency, but he would sit in the corner and smoke a cigar. So that was his big job. So I knew that midwives, that you could have midwives, you know, attend your birth, because that was my birth story. Yeah, and then it was years later I came across Seattle Midwifery School, which is now the Department of Midwifery at Bastyr University here in Washington. I have a master's degree from there. I don't think you need a master's degree to be a midwife, but I've worked pretty hard for it, so you know, I like to toot my own horn sometimes.
Oh no, God, please toot away. That's an amazing accomplishment. And then Myra, I guess I'm curious how you heard about midwives and what directed you to Emi.
So my friend in Denver actually sent me the book, and Emi might have to chime in, by Ina May Gaskin. Not the first one, the second book, Childbirth. Sorry, I don't know the name. And I read that book and was like, this feels good. And that was what made me really stop and think about what I wanted the story to be. It felt good, and it felt right for me and what I wanted my story to be. And what led me to Emi was I had gone through the search. I talked to a lot of Caucasian women. And granted, both my step-parents are Caucasian, so I don't have an issue per se. But when I was looking at how they made me feel when I interviewed with them, it felt a little more sterile. Less sterile than, you know, the traditional hospital OB. But it just didn't fit right. So when I talked to Emi, we just had a good old time laughing and relating about what life was like. And that's kind of what made me commit to having my birth story work with Emi.
That's awesome. Thank you. I'm glad that you found this care. I'll pass it back to Mary.
I love that there's so many options available to you when you're giving birth and throughout your pregnancy, and it's I'm loving that it's becoming more well known. So, and Emi, you mentioned that you studied at what is now Bastyr, and that you got a master's from there, but that you don't necessarily need one. What are the paths to becoming a midwife? Like, if someone was interested, how could one become a midwife?
Let's see, to become a midwife, there are many different routes to it. You can go the nurse midwifery route, where you would get like a bachelor's in nursing at UW or SU, a school like that. That would be Seattle University. And then those folks are usually going to work in the hospital, not always, but usually. You can go to a school. There's the MEEC schools. That's the Midwifery Education Association Council, something like that. That's for they credential schools that are for out of hospital midwives.
Mm-hmm.
So that would be like Bastyr, Midwives College of Utah, National College of Midwifery, and then some folks in some states you can do a apprenticeship route, so where you like go to births and you assist a midwife and you do all your book learning, like you do it like out of a book rather than being in a classroom with other students, and so that can be kind of challenging. It looks like someone's asking, is there financial assistance and how long does it take to become a certified midwife? The financial assistance, if you go to a school like UW, it's going to be the same as for any other public or private university. If you go, some of the MEEC schools do accept federal student loans and grants. Some of them don't. It just depends on the school. And then in terms of how many years it takes, the Bastyr program is 3 years long. I did it in 3.5 years. Took me 6 more months to complete my master's, even though I'd finished everything else. And then some people have prerequisites, prereqs that they have to take. So it might be, 1 to 2 years of prereqs as well. So there's not as much financial assistance as there should be, but there are some really good programs out there. There's the Health Professionals Loan Repayment Program, and that's on a federal level and the state level. And the state level here in Washington does fund licensed midwives and direct entry midwives as well as nurse midwives.
Oh, that is good to know. That's a great resource.
Yeah, I've actually learned, because I didn't know that you could just like essentially shadow a midwife and learn that way. That's, man, I could imagine how that would be challenging, but like kind of fun. So then we're almost done. We have a couple more questions for you. So my next one for you is, do you need insurance to utilize a midwife? Or how does the insurance process work with you?
Yeah, so here in Washington, most people use their health insurance to see a midwife. So we can accept Medicaid or Washington Apple Health. That's the state insurance. We can also accept private insurance, and that's more common here in Seattle. In some of the outlying areas, like in central Washington or out on the peninsula, the midwives might not necessarily accept insurance. They don't necessarily have to, but I encourage all my colleagues to, because it increases access. But yeah, absolutely. If someone has Apple insurance, Apple Health, we can see them. And I always tell folks, I've had clients like, someone had a miscarriage and was going to come back and see me for her second pregnancy, but didn't have any insurance. I was like, just come see me. Just come see me. Let's just get your care started. We'll figure out the insurance later. But you don't need to wait till your second trimester. Let's figure something out. Let's get you seen. Rather than having you just wonder how the pregnancy is going until you can afford to see someone.
Right, because cost can be a massive barrier.
Yeah.
Can I speak to that really quick?
Yes, absolutely.
I know for me, I didn't know that midwives were covered by insurance, and I was on Medicaid. And when I had finally committed to I'm going to look into midwifery and saw that that was just the most amazing feeling, because I thought midwifery was just something, that people had to be able to afford to have access to. So knowing that it was accessible was a giant sigh of relief and a joy, just because I knew, okay, this is doable. I can have a birth the way I want to. It's not dictated by my insurance, but I get to choose how this is going to play out and not have the insurance cost or what it is after looming over me.
Right. And correct me if I'm wrong, Emi, but I've heard that it's pretty recent that a lot of midwives take insurance, and it was more accessible in that way.
Yeah. And we're seeing that in more and more states as well. that midwives are taking insurance. Mm-hmm.
Yeah, awesome.
It's awesome. So let's see, we have a couple more questions. Actually, this is just fun and kind of related to COVID and the pandemic, but what self-care practices have been helpful for you during the pandemic? I'll start with you, Emi.
Oh, self-care practices. I having dance parties.
Mm-hmm.
I definitely put on Pandora and like sing to myself while I'm doing the dishes in my kitchen. And then flat ironing my hair, taking care of my hair, doing my makeup makes me feel like put together, even though I'm
Mm-hmm.
mostly working from home. Those are the things I like to do for self-care.
I love it.
Yeah, those are good self-care practices. What's your current favorite song to jam to right now?
Ooh, I really love like it's top 40, like Cardi B and Megan Thee Stallion. I'm like, yes, let's do this.
Ooh, Emi, yeah.
That's very relatable. Oh my gosh. We're gonna have to have like a Zoom dance party soon.
Sure.
I think that would be really fun.
That would be great, like a Pauhana dance party.
Yeah, right. Yeah. And the over. Yeah. How about you, Myra?
We like to eat, if that's not evident. So there's a lot of cooking here and a lot of eating because he has one tooth that does amazing with food. We like to go outside. We like to walk when we can. We like to go on adventures. We like to get out and just kind of see the world best we can because he doesn't get to see very many people. So, when we can, we get outside and people smile and he sees at least their eyes. So
Right.
This generation will know how to read eyes.
Ooh.
Which cannot lie. And we have
It's
dance
gonna be a
parties.
really neat dance party.
Yeah, and singing. He likes to sing. So that's our self-care, huh? Yeah.
I love it. Oh, so there is one more comment out of the comments. Did I say comments out of the comments? Anyways, some expectant parents feel that an OB is the safest option. But maybe Myra, maybe you can tell us some of your ideas how to explain to community members that midwives are safe, or even Emi, how you explain it.
I'll let Emi go first.
I just talk to folks about that feels safe to them. So we do the usual blood work that's offered. We can send people for ultrasounds. So I tell them that we can cover their like normal pregnancy care, but if we do need to send them to an OB, then we'll pick up the phone and call an OB. We'll make an appointment for them if we need them to see an OB. And for folks that they feel like the OB is the safest option, that's fine. See an OB, go safe. That's really important. That's going to help you have a baby. But folks get to know us, and sometimes they like us more. Myra, do you want to answer that question?
Well, I can speak to both because I started with an OB, and it was, the traditional OB care. Sorry, hold on. Are you okay? Yeah. Okay. Am I finished? And then once I read the book and I got a better understanding of what a midwife actually does and how specialized midwifery is and the extent of knowledge and studying they do, it made me really stop and think about the relationship aspect as well as the scientific aspect. So yes, OBs definitely have the medical background, but for something so personal as your birthing and bringing this new life into the world, it was important to me to have someone that was really going to take that extra step and not rush me out of a doctor's office, right? Like, oh, there's 15, like you get your 15 or half an hour, and then like they got to go on to the next patient. Whereas the midwifery care I got was more specialized, and if there were follow-up questions, granted, sometimes we ran out of time, you know, there was the follow-up, hey, I'll follow up with an email, or let's schedule another time that we can talk again. So for me, that was kind of the defining factor of, I really want to be heard. I don't want to be rushed, especially in the pandemic when so much is unknown. And midwives, they keep up with all the pandemic COVID news as well. So they're not unaware of what's happening in real time. They're just more specialized in the birthing process and can offer more to cater to what you need as a mom. You know, it's such a big event that really having that person, because knowing my OB might deliver was like, but I want my OB, you know, but you don't get your OB per se, you get whoever's on call. And it's like, but are they going to know my history when they walk in the room? Are they going to know my cancer history? Are they going to know to be gentle about this and that, you know? So for me, that was really the defining factor of, I want someone who's going to carry me through this and partner with me and not just be like, hey, so when you get to the hospital, it might be me, not me, but you'll be all right.
Yeah.
That's super important in your pregnancy journey, and not having to repeat yourself too, you know,
Right.
because somebody sorry, I'm getting a little tongue-tied. You've established a relationship and rapport. So
Yes.
yeah.
And it's what they do. Midwives, they bring babies into this world. They're not just looking at your lady bits, they bring babies into this world. So for me, I'm like, yeah, this is what you do. Like, you wanted to specifically do this, bring babies into the world. So you're gonna take that extra step to bring my babies safely into this world with as much joy as possible.
Yeah, that's actually a really great way to put it. Never thought about it that way. Like, they're gonna take that extra step because it is what they do.
They decided they wanted to do that. Whereas OBs, there's different aspects of OB, but midwives, they wanted to bring the little ones. They wanted to bring the fire.
He's adorable. Oh my gosh.
He is so sweet.
Hi, baby.
Well, thank you so much, everyone. Myra, it was great hearing your stories and your perspective on your care and on your pregnancy journey and working with Emi. I learned so much today about midwives and midwifery care. It was always something that I was very curious about. And so thank you for coming on and telling us, sharing what you do. And yeah, I think we have all our questions. I don't see any in the chat. So yeah, thank you all at home for watching the show.
Thank you, everybody.
Take care, everyone.
Bye, baby.
Bye.